Staker here with Westside-Medical. Today we're going to talk about the exercise progression we use in my clinic for disc injuries. So if you look at these discs here, this is what a normal disc looks like. You have an outer fibrous part and an inner jelly part. And we have like a disc injury. What happens is this inner jelly part, or the nucleus pulposus, it starts to rupture through here into this outer part, and that's where you start with the bulge. And then as this middle jelly part here continues to rupture through, this is called the annulus fibrosus, as it continues to rupture through there, that's where you eventually get the herniation. And so when we start with an exercise protocol, the first thing we want to do is we want to lower the inner discal pressure. And the best way to do that is have somebody to lay down. That's the position where you have the least pressure. And so the purpose of that is when you have the least pressure through here, that's going to, let's say this injured one here, when you have the less pressure, it's going to allow this here, the nucleus pulposus, this part that's kind of bulging through, to reduce. So the first step is you want them laying down, and the second step is you want to have them face down, because the majority of disc issues are posterior. This is the back of the spine here, if you can see. These are the spinous processes, and this is the front. This is the front of the lumbar body. So you want somebody to lay face down. And the reason for that is you use, it's called like gravitational assistance. So when you lay face down, gravity is going to push this way. It's going to help to reduce that also. Or with a herniation, you want to have it to try to reduce back that way, laying face down. And so, get these out of the way. So you have a patient starting off in the laying face down position. You're kind of limited in the exercise you can do. But how we start is the first step we have somebody lay face down. And this would be for a very acute patient. Up a little bit here. Have them lay face down and just start lifting the single legs. And that's going to fire the glute as well as the erectors. And just start working that area. And as they're able to do that, you're going to add some different variations to it. Where you do opposite arm, opposite leg. And that's going to work so that lat, the glute, hamstring. So have them progress through here. And the next step is we're going to have them start with the, it's called the Superman and Bird Dog, whatever you want to call it. So you notice here, they're still technically in the laying down position. All the anti-gravity muscles are relaxed. So have them start just sticking the leg out. You can hold for 10 seconds. You can rotate legs, and as that gets easier, now you add variation where you kind of start writing the alphabet with the leg. Right now I'm really not writing anything, but you get to understand the point. And that's going to create a little bit more demand to the body. Then once you get through that, this is where the real Superman comes in. You do opposite arm, opposite leg. You want to keep the stomach tight. And you're just going to hold it there, and that works the core while your disc is still in a good position. So once you progress through those, in my clinic, we then go to the reverse hyper here. If you notice the positioning, you're laying face down as well as your prone, which is the face down position. Now we really like this because we're actually able to start loading the exercise versus when you're just doing like the Superman exercise, it's kind of difficult to load it. So here you can really, really work on strengthening the lumbar spine while the disc is still in a good position. So let me demonstrate how it works. We have a patient, you step up these pegs, the pegs here. We want them about where the femur is here as the pivot point, so maybe half the pelvis on here. And so you're going to lay down here. So the disc is in its lowest interdiscal pressure, so there's the least amount of pressure in the disc. Gravity is pushing that bulge or herniation back the way it needs to go to reduce it. And now just have them go through the range of motion here. And so the disc is in a good position, and you're able to work those lumbar muscles and strengthen the spine. What's nice is here too is when the legs drop down, you get posterior hip rotation, and that creates a really nice traction that also helps with the interdiscal pressure and allows a lot of circulation of nutrients and oxygen to help heal up the disc injury. So that's progression. of dish treatments in my office. Hopefully it helps you guys out.